I think shoulder is the most complex joint in the human body. Shoulder replacement surgery in my practice as a shoulder surgeon is the most rewarding surgery because I see how patients are significantly disabled and in significant pain before we do the surgery, and then even a few days after surgery, some patients call me and say, hey, I want to thank you. It is an excellent surgery for the right patient, and they can expect, in most cases, near full recovery and complete pain relief. Certain factors that tell you, hey, this pain that I'm having may be something more than just a muscle strain or a little bit of inflammation in your shoulder is when you're having constant pain. You're watching TV at home, you barely move your shoulder, and you experience a lot of pain. Or the pain wakes you up at night. Or you feel grinding and clicking in the joint, constant grinding and clicking. That's another, indicator that something might be going on. Or if you start losing motion and all of a sudden you can't really raise your arm up above shoulder level anymore, those are some of the things that tell us, okay, there might be something more serious going on that might need a little bit more of invasive management. We know that symptoms and the amount of pain you have does not necessarily correlate with age or the severity of the x-rays. You may have an x-ray that looks like you have severe arthritis, bone on bone, that without me knowing you, I could tell you, oh, that's a shoulder replacement. But then I meet the patient and they're not that limited. They're more or less happy with their motion. Their activities are not that demanding. So we could be able to manage that patient simply with periodic steroid injection, cortisone injections, and that's all they may need. And they're happy. Many of my patients, they come in every 3 months. I give them a cortisone injection, and they're like, okay, I'll see you in 3 months. And they're not interested in a shoulder replacement. And I love that approach as well. Every patient has a different set of preferences, different priorities, and I'm happy to tailor my recommendations to whatever they think is best. Typically, it's a total shoulder replacement, and what I have here is a model of a reverse total shoulder replacement. It is the most commonly used shoulder replacement nowadays. About 80-90% of shoulder replacements we do are reverse total shoulder replacements. And in this particular replacement, what we do is we reverse the roles of the ball and the socket by, putting the new ball where the socket used to be, okay, and the new socket where the ball used to be. And we cut the ball and we put the socket in here, and this articulates just like that, and it allows you to move your shoulder with no pain or very little pain, and patients experience great relief, and recovery is, believe it or not, pretty fast. The patients are doing a lot of things already within a month from surgery. Everyone's a little different, but my patients, you're in a sling for about 2 weeks at all times. So until I see you for the first visit, you're wearing a sling. We want to make sure the wound's healing okay. We want to make sure that the metal is growing into the bone. So we want to minimize the excessive motion in that shoulder. And then once that sling comes off at 2 weeks, then you start moving your shoulder with physical therapy. We start with passive motion, in which they help you move your arm up to the side, and then within a few weeks, and every patient is a little bit different, within a few weeks, they can start doing active motion themselves. Some still have some certain limitations, or they might experience that they may not be able to, for instance, get their hand behind their back as well as they used to. But all in all, over 90% of patients are extremely satisfied and happy that they had the surgery done. As with any surgery, there are risks associated with the surgery. Infection is a common one, although the risk of infection is less than 1%, and it is lower than that of hip and knee replacements. Other risks, such as fractures, or basically, a bone breaking your bone, which should happen during surgery. Very rare, but it can happen, especially in older patients with osteoporosis. Or after surgery, because you have to think, you haven't been using your shoulder for years, right? Because it was hurting so much, and now all of a sudden we're asking you to do physical therapy, strengthen your shoulder, and we may be putting a little bit too much stress on the shoulder, and they can create a fracture. Many of those can be treated without surgery, but it will slow your recovery a little bit, and some might need surgery. And then another important one I would say is component dislocation, where the joint replacement can come out of the socket, which is why we keep you in a sling at the beginning. We limit a little bit what you can do as the soft tissues around the shoulder scar in a little bit and create a little bit of a more stable joint. I would say working out is really excellent idea. Moving your shoulder, making sure it doesn't get stiff, even if there's a little pain. You can always come see a shoulder specialist. We can reassure you, okay, this is normal or expected. You may have some inflammation, bursitis, tendinitis of your rotator cuff, but it does not mean, okay, because it's hurting, I shouldn't move it. If anything, we would send you to physical therapy. We make sure that they are working on improving your posture, making sure that some of the exercises you're doing are addressing the inflammation that you're having. And then, whether it's through your gym or sports you may like, I would say the more active you are, the healthier you eat, obviously, that's gonna help you overall long term for sure.